Nothing is worse than having new onset of weird symptoms in your 30s, 40s, and 50s, going to your doc and being told that there is nothing wrong with you. And after talking to so many women and realizing that they're getting either ignored or shunned, made me realize that we need to talk more about these symptoms so you don't feel either crazy or that it's all in your head. So let's get into it. Welcome back to my channel. I'm Dr. Renee. I help women balance their hormones naturally. And before we get into it, a little disclaimer. The videos on this channel are for informational and educational purposes only. They're not intended to be taken as professional medical advice. While I am a doctor, I am not your doctor. So do me a huge favor. If you have a health concern or a medical need, please consult your own personal doctor or healthcare practitioner. Okay? With that out of the way, let's get into it. So, what exactly is perimenopause? Well, perimenopause literally means around menopause. It's the time in a woman's life when her periods start to become irregular. It's when our female hormones, estrogen and progesterone, their levels start to fluctuate less predictably as we approach the menopause transition. This usually takes place the 3 to 5 years leading up to menopause, but can last upwards of 10 years. The average age of onset of perimenopause is usually between 40 and 44, but can occur as early as the mid to late 30s. And to be honest, perimenopause can be more difficult to experience for some women because the hormone levels may be low 1 month and high the next. This unpredictability and the fact that so many docs don't recognize it as a condition that needs to be addressed oftentimes makes it harder to deal with than menopause. What makes this even more difficult is that many of the symptoms may seem to come on gradually, so they don't even know what's happening. One day you just wake up and all of a sudden you feel like you've gained 10 pounds, you're always moody, and you're no longer able to get a good night's sleep. And I talk to women every day with symptoms that sound like perimenopause. And when I ask if they've gone to their doctor to seek help, they often respond yes. But they're told things like, it's normal, you're too young. And yesterday, I had a woman tell me that her female OBGYN told her, it's part of life and you'll have to learn to accept it. Other things are told is that there's nothing that can be done or they're just simply ignored. And if they are treated, they're often prescribed medication for either anxiety or depression without even discussing other options. Okay, before we get into symptoms, if you're a perimenopausal woman dealing with many of the symptoms I'm about to discuss, and you want to take a more holistic approach to your health, be sure to not only subscribe to this channel, but come and find me on social media. And many of the concepts in my videos on this channel are the basis of the strategies I use in my 12-week hormone balancing program, the Hormone Code. So if you're tired of trying to figure out all the things on your own and you want my help in designing a personalized health plan just for you, apply for a call. I'd love to see if working together is a good fit for both of us. And I'll be sure to put the link to schedule a call below. Okay, so now let's talk about some of the symptoms that can occur with perimenopause. The one I hear most commonly are irregular periods. As your hormone levels fluctuate, the length of time between periods may be longer or shorter. Your flow may vary from light to heavy, and you may actually start skipping some months. Your classic 28-day cycle may become a thing of the past. The next common thing I hear are hot flashes and night sweats. They're two of the more common symptoms of perimenopause, but what you have to know is that not every woman will get them. But if you do, they're probably going to vary in regards to intensity, length, and frequency. On a personal note, I wear this thing called an Oura ring, and I realized at the beginning of winter 2023 that my sleep was very disrupted. I seemed to be very restless, and I thought it was due to stress until I realized a few nights I was thrown off the covers because I was hot. Then I realized that I was asking my kids like almost daily, is it hot in the house? So I finally figured out that I was having hot flashes when they told me repeatedly that it must just be me. So something that you thought would be so obvious was actually very subtle. And it wasn't until I personally became aware of my symptoms that I put the pieces together. Some women may experience sleep problems. Often these could be due to night sweats, but sometimes you can just begin to have disrupted sleep without even having the night sweats. Perimenopausal women many times will have higher stress levels compared to premenopausal women, which may in turn impact sleep. You may notice mood swings. Maybe you're more irritable, you have increased anxiety or depression. Again, very common during the perimenopausal years. These may be due from lack of sleep, the fluctuating hormone levels, as well as increased stress levels. You may notice vaginal and bladder problems. The vaginal tissues are very dependent on estrogen. So, when our estrogen levels begin to fall, your vaginal tissues may be less lubricated and may actually lose some elasticity, which will in turn make intercourse more painful. Low estrogen may also leave you more susceptible to bladder or vaginal infections, as well as leakage of urine, especially when you do things like cough, jump, or even run. You may notice a low libido. During perimenopause, sexual arousal and desire may change. Again, this could be due to hormonal fluctuations, stress, or even relationship issues that can occur as a woman and her partner get into midlife. Some other symptoms that may occur that we don't talk about a lot include things like stubborn weight gain, bloating, trouble concentrating. You might develop itchy skin, gut issues, or even changes in your body odor. Okay, and then there are a couple things that you may not notice on a physical level, but could be occurring deep down, which include loss of bone. With declining estrogen levels, you start to lose bone more quickly than you replace it, which will in turn increase your risk of osteoporosis. And then you may notice that your cholesterol levels are changing. The declining estrogen levels may lead to unfavorable changes in your cholesterol levels, including an increase in LDL, which is also known as our bad cholesterol, and a decrease in your HDL, also known as your good cholesterol. Both of these together may increase your risk of heart disease. And if you enjoyed this video and you want more information on how to get your hormones more balanced, check out this video where I talked about 5 strategies to naturally reset your hormones. And with that, we'll see you right back here next week. Ciao.